infection in your breast, you very rarely will see the yeast infection here on the nipple. The yeast lives inside the breast, behind the nipple, and it can crawl up the ducts, causing pain. How do you know you have a ductile yeast infection? The best way to diagnose it is the symptoms of your pain. If you have any burning, biting, sharp shooting, stinging pains, it just feels itchy, it feels burny and hot, that is usually a ductile yeast infection. Sometimes you will see a thrush infection in the baby's mouth, which you will notice as white little patches on the tongue or inner cheeks that do not come off when you try to wipe them off gently. You can have a yeast infection with thrush in the baby's mouth or without thrush in the baby's mouth. If the baby's mouth is clear and you're having the pains I described, you are probably having a yeast infection. When we treat this, the mother and the baby must be treated simultaneously, even if only one has the symptoms, which means if your baby has oral thrush and you do not feel the pain, you both need to be treated simultaneously. The treatment is for 14 days straight. You should start feeling better from the treatment within 2 to 4 days, but you must continue on for 14 days or it will not clear completely. When you treat yourself with an antifungal cream, which you can get from your pediatrician or your local pharmacy, you must treat the whole nipple and areola. You take the cream, you massage it into the nipple and areola after every feed, and do not wash off. You will treat the baby's mouth with an antifungal, depending on the medication, 1 to 4 times a day after a feed. And if you treat your yeast infection for 14 days straight, you and your baby should feel better and you should be able to continue breastfeeding for as long as you would like.